Hi everybody, it's Dr. Newman. Recently I've seen other doctors' Instagram posts about doing breast augmentation under local anesthesia. And I have to tell you that in my practice, that's not something that I do. And my reasons are pretty clear. When I do breast augmentation, for me to do this under local anesthesia, first and foremost, there's the pain issue. And if I'm putting the implant in underneath the muscle, it's very difficult to anesthetize the muscle so that people aren't feeling muscle pain while I'm creating that space under the muscle for the implant. So then the question is, well, what about putting the implant in over the muscle so that the muscle isn't really involved? And first of all, the indication for putting implants in over the muscle is a whole other conversation. But as far as the anesthesia is concerned, in order for me to anesthetize the breast enough so that basically the undersurface of the breast where I'll be working to make that pocket is something that needs to be anesthetized, that's a lot of anesthesia. So just think about the fact that most breast implants, depending upon the style, the interval from breast implant to implant is only about 25 to 30 cc's from one size to the next. Well, for me to anesthetize the entire breast, I'm injecting 100 to 150 cc's of local anesthesia. So you can imagine how just in appearance, just injecting the local anesthesia itself changes the appearance of the breast, the way the shape of the breast looks, and certainly when I sit the patient up or lie the patient down, they look completely different with that extra 100 to 150 cc's of local anesthesia that's there. So to me, that really changes my judgment and it changes my ability to really give somebody a result that I'm confident of in the operating room is going to look good after the operating room. As far as I'm concerned, this is your body. Do this in a controlled environment and do it correctly. It doesn't mean that it's impossible to do this under local. It's just as far as I'm concerned, the benefits of doing this under general anesthesia far outweigh the risks and the downside.